Welcome back. Today our sponsors at Sauna Physical Therapy are joining us to discuss their services in helping people lead healthier lives. Welcome co-founders Rachel and Bryn. Thanks so much for coming in today, ladies.
Hi, thank you, Chelsea.
Of course. Alrighty. So today's topic is all about pelvic health. So explain to us the different types of pelvic health problems that you are able to treat.
Yeah, well, at Sauna we see all types of patients for different dysfunctions with physical therapy. Today we are just going to focus on the pelvic floor services we offer. So we see all different kinds of dysfunction, from pelvic pain, urinary incontinence, which can just mean leaking when you laugh or cough or sneeze, like so many of us do. We see pediatric patients. We see pre and postnatal patients, and we also treat men, which there's not many clinics that treat men and pediatric patients in Western New York. So
yeah, that's great. I love that. Okay, so how do you service the spectrum? You just talked about a myriad of different options when it comes to pelvic health. So how do you talk about or treat that kind of spectrum of patients?
Yeah, well, we all have pelvic floors. So starting with pediatrics, we see children that are having issues with constipation, maybe difficulty urinating, maybe they're past the age of 6, but they're still wetting the bed at night. So we can help parents and caregivers with education and support for the kids to get them through some of those issues. Later in life, prenatal and postnatal patients, we do birth prep. We prepare you for labor and teaching you the stages of labor, the best biomechanics for pushing, how to prevent tears during labor, different birthing positions. And then pregnant women have, different aches and pains in their backs and hips and pelvis, and we can help address and alleviate some of those issues. Yeah. And then postnatal, rehabbing after having the baby, maybe they're concerned about diastasis recti, maybe they're still having some leakage and different pelvic floor issues. So it's really great to get in with a pelvic floor PT right after to address some of these concerns before they become worse later on.
Yeah. Let's talk about the benefits of one-on-one with your doctor of physical therapy.
Yes. So at Sauna, we have 4 pelvic floor specialists, and we try not to have a wait list. So we try to get you in as early as, let's say, next week if you needed us. And it's just one-on-one with your doctor of physical therapy the entire time. We don't use aides or assistants, and it's always just focused on quality care with that doctor of physical therapy. I wanted to just point out too, as the age progresses, after we go through the postnatal stage, we see a lot of patients with a pelvic organ prolapse. And what that is it's sometimes like that feeling, that sensation of heaviness in your body. It can lead to pain, it can lead to leakage, it can lead to urinary incontinence, as Bryn was saying, but that can come in the form of like stress urinary incontinence, where you're coughing or sneezing or maybe just standing up and leaking, or urge urinary incontinence, where you have that urge to go, quite a bit, and your day is being planned around where the bathrooms are, or you're driving into your garage, and all of a sudden it hits you that you really have to go. We can really help educate and treat that dysfunction as well. We do see a lot of patients post surgeries, and also post cancer treatments for the pelvis too, where that tissue really can get eroded and dysfunctional and cause pelvic pain and weakness in those muscles. And like Bryn said, we also treat men's pelvic floor issues as well.
Right. Okay. Now listen, we are in the middle of Medicare enrollment, and I know that you actually take that, which is huge. So I want you to let our viewers know what they should be looking out for in their plan if they want to make sure their insurance benefits can cover Sauna and coming to see you. Yes.
So we do accept traditional Medicare, and that is what's happening right now with Medicare enrollment. So 98% of U.S. hospital systems and physicians also take traditional traditional Medicare, and we just kind of want to let the public know that that's different than a Medicare replacement plan, or what they also call Medicare Advantage plans. That's not traditional Medicare.
Okay.
They've kind of given up their Medicare in order to get into these privatized plans. So traditional Medicare we accept, but if you are on one of those replacement or Advantage plans, the PPO, the Preferred Provider Organization, those plans within those Medicare Advantage plans, we also accept, but we do not accept the HMOs within those plans.
Good tips to know there. Now, for those of our viewers that haven't been out to see you, you're located in East Aurora, and if that's a little too far for someone, you actually do offer virtual pelvic health. So tell us about that.
Yeah, well, we found the need in the community for patients who are living in areas that don't have immediate access to pelvic floor PT, or if they do, there's a long wait list to get in. So in person is always best, but any kind of care is better than no care. And we'd love to just provide as much education and assistance to those patients as possible. And maybe you can get out for one treatment, get the evaluation done, and then your follow-up can be virtual.
Yeah,
So,
makes sense. Yeah. Where can our viewers go to get in touch with you and learn more about all of the services that you have to offer at Sana?
They can visit our website, www.sanahealthandwellness.com. They can give us a call, 716-671-SANA. And yeah, we can answer any questions. We have our Pilates wellness as well, our group Pilates classes and our private Pilates classes.
Massage services too.
Yeah.
There's a whole gamut. So if you'd like more information on all the kinds of treatments offered through our sponsors at Sana Physical Therapy, you can visit their website at sanahealthandwellness.com or by calling that number on your screen. Thank you so much for coming in, ladies.
Thank you.
I know the importance of talking about our pelvic floor.
Yes.